If you have type 2 diabetes, which is because of insulin resistance, because you have excess body fat, the first thing you need to do is to drop the excess body fat levels. I've had a patient who was on 200 units of insulin who actually dropped to 0 units of insulin when he changed his diet around and he went for a walk or a jog every day.
Wow.
Okay? So I've seen it and it works, and this is not someone who did anything drastic like surgery or anything like that. He basically just changed his routine around. So every year I'm stunned by patients who come back and say, "Doc, you know, I listened to your advice," and because the next year when I see them, I can't recognize them. And I'm like, "Oh, hi, are you my patient?" They're like, yeah. I was like, "Oh, but that was 25 kilos ago."
Right.
You know?
So it can be done. It is possible.
Absolutely. If someone is pre-diabetic, the best thing you can do is to shed a little bit of excess weight. It doesn't have to be a huge amount. Take control of what you're eating. Make sure that you don't flood your digestive system with a lot of simple sugars. So that's not going to get absorbed into your bloodstream very fast. That's going to stress your overworked pancreas already to push more insulin out. So yes, absolutely. And in fact, a number of the studies have shown that it is not the weight loss that's the key. It is the actions that people take on a regular basis. And that's why I talked about a routine. I'm not sure if you appreciate how important that is. Getting that routine going is very important, you know? So being active on a regular basis. Again, going back to the car example, if you pump petrol in the car, the best way to burn the petrol is to drive the car, right? Not park downstairs in the car park and then switch on your aircon and listen to music. Not a good way to burn petrol in your car, right? So best is to drive it, and if you can, drive up to Malacca, drive up to KL, have a long drive, right? So that those things are actually very practical and reasonable ways that we should manage.
Okay.